Welcome viewers from around Ontario. Over the next 30 minutes, we'll bring you the latest local news from Ottawa, Windsor, and here in Toronto. First, some tough words today from Canadian health officials.
We're in it for the long haul. It's not going to be days and weeks, it's definitely months, many months. And the one thing that other countries are also looking at, and we're looking at as well, is there a possibility of a second wave? Who knows?
The COVID-19 pandemic is not going to end anytime soon. This as the number of cases here in Ontario nears 1,000. Today, there are 135 new cases in the province, bringing the total number to 993. There are 18 virus-related deaths, up from 15 yesterday. 43 people are in intensive care in hospital, a number that has more than doubled since earlier in the week, and 8 cases are now resolved. There have also been 29,967 people who have tested negative for the virus. So that is where we stand right now, but some health experts believe things could soon get much worse. They are expecting a surge of new cases, and while they can't be sure of the timing, they are rushing to get ready. Lauren Pelly explains.
There's a growing sense among clinicians that right now could be the calm before a storm of COVID-19 patients.
It's almost inevitable that we are going to see a surge.
Thanks to a mix of rising spread in the community and more travelers coming back home to Canada.
I think our best estimates are that we'll start seeing a rise in the next week or so, and it'll continue to rise for weeks thereafter, if not months.
At the beginning of March, public health officials tallied up only a handful of known new cases each day at the most. Then those daily counts started ticking upward. By March 25th, Ontario first hit 100 new cases reported in a single day. Ontario reported well over 100 new cases yesterday and today as well. And those are just the results that are being confirmed by public health labs. It's not counting the backlog of thousands of tests or untold numbers of residents who aren't being tested at all and could be spreading the virus in their communities. Without a clear sense of how many people really have COVID-19, healthcare workers are bracing for the worst.
We've been making a lot of changes physically in our structures, but also in our flows and our pathways to ensure that when a patient comes to our doors at the front of the emergency department, they're quickly identified as potentially at risk of COVID or not, and they are streamed into 2 separate areas.
And amid growing concerns over potential ventilator shortages, Ontario's health minister says,
we have an active order that we're working on with auto parts suppliers to supply us with an additional 10,000 ventilators. This is going to be vital. We need to have this in our hospitals.
Now it's just a painful waiting game to see how fast that storm will come and whether or not Ontario's healthcare system can handle it. Lauren Pelly, CBC News, Toronto.
The Oshawa grocery store employee who tested positive for COVID-19 has died. 48-year-old Keith Saunders worked at a Real Canadian Superstore in Oshawa. Officials say he had not traveled and are investigating how he could have contracted the virus. The Bowmanville man died in hospital Wednesday. He is Durham Region's 3rd death due to COVID-19. The store posted a statement online saying Saunders was last in the store on March 16th. Durham Public Health says the risk of transmission to customers is very low. We want to give you an idea of what it's like to care for a patient with COVID-19. Dr. Nisha Andani knows this firsthand. She's an infectious disease physician at Sunnybrook Hospital. I spoke with Dr. Andani about what the last few weeks have been like treating COVID patients.
Last week, for example, we had only 3 patients admitted to hospital at Sunnybrook, 1 in the intensive care unit. And this week we have 9 who are admitted, 4 in the intensive care unit. So we've seen an increase just in the last week. We also have several more individuals who are being investigated for COVID-19, and so that means a lot more patients in isolation. We previously used to get an email list of whoever is a person under investigation, and now they've stopped doing that just because the volumes are so high.
There has been some worry about frontline workers like yourself, hospital staff. They've raised concerns about the lack of personal protective equipment and ventilators. What's the situation at Sunnybrook, and do you have any personal concerns about that?
Personally, I have not experienced an issue with access to personal protective equipment, and I know that our infection control department and our senior leadership are exploring various avenues in order to ensure that we have an ongoing supply of PPE.
We've been talking about the numbers growing up. We're also seeing the numbers rise in some young people, and there seems to be, I don't know if we can call it a misconception, but people believe that this is just something that's going to affect the older people in our society. What do you have to say to people out there that may have that thought process that, you know what, I'm young, I'm healthy, coronavirus, it's not going to hurt me?
You know, you may hear reports of younger individuals in their 20s, 30s, or 40s, for example, who are being hospitalized and receiving intensive care, for example. And while thankfully, you know, that's not the majority, it is still possible. And so I would say, you know, even though, yes, for the majority of young people, it would be a very mild illness, that's not necessarily always going to be the case. But we also have to think about, even if somebody young does have a mild infection, who are they potentially passing that along to, and can that person actually cope with the infection?
You're also treating COVID-19 outpatients who are recovering at home and doing it by video or phone. I mean, we're talking by Skype right now. Yeah. How difficult does that make your job?
You know, we're very much used to seeing patients in person and delivering care in person, and we've had to rethink that. I would say it's been encouraging, and I hope reassuring to patients that they have somebody who is checking in on them, talking them through, you know, what symptoms are expected, what their clinical course might look like, when is it appropriate to seek extra care, et cetera. But at the same time, you know, certainly it is difficult in the sense that I can't do a physical exam, and so you're somewhat limited in how you can assess the patient. You know, if they complain of shortness of breath, well, I can't really listen to their lungs, for example, and see if there's something to worry about. So I think it has its advantages, certainly in terms of physical distancing and keeping people safe, but there are some potential limitations in terms of not being able to physically examine patients.
What can we do as the general public to help in this?
So I think the most important thing that the public can do is, again, just to do whatever you can to flatten the curve, right? We have to make sure that our healthcare system has the capacity to manage whatever COVID-19 infections that we see as a country and as a city. And so, you know, it's really important, those measures of social distancing and physical distancing. And again, that doesn't mean social isolation. We encourage people to communicate virtually in other ways to ensure that they're still maintaining their mental health and well-being. But that physical distance is very important in terms of preventing transmission, washing your hands frequently, and, you know, avoiding touching your face, all things that you've heard before, but I want to emphasize are so important in terms of slowing down the spread of this infection.
Really appreciate Dr. Andani's time. Ottawa is substantially increasing its wage subsidy to help companies in these tough economic times.
We're bringing that percentage up to 75% for qualifying businesses. This means that people will continue to be paid even though their employer has had to slow down or stop its operations because of COVID-19. We're helping companies keep people on the payroll so that workers are supported and the economy is positioned to recover from this.
The Prime Minister says payroll assistance will be backdated to March 15th, 2020. Its goal, to help companies rehire recently laid off workers and keep them on for the coming months. Similar businesses will also have access to guaranteed bank loans of up to $40,000, interest-free for 1 year. GST and HST payments, duties, and taxes on imported goods will also be deferred until June. And in a surprise move, the Bank of Canada slashed its overnight rate again today. It is now at 0.25%. That's a drop of 50 basis points, matching the record low. The governor of the bank says he is willing to use any tools at his disposal to help stabilize the economy.
Some may suggest that this is using a lot of firepower, but I think that you know, a firefighter has never been criticized for using too much water.
This is the third cut in just weeks. Toronto Police confirming tonight one of their officers has COVID-19, while the city says there are 4 confirmed cases in our shelter system. In Ottawa, the numbers are rising there too. Now health officials in the nation's capital are changing the way they track cases of the virus. Omar Dabagi Pacheco is outside our studios in Ottawa with the very latest. And Omar, why are they bringing in this change in reporting the numbers?
Yeah, Dwight, they used to run the samples twice before confirming them as a positive test and tracking them. Now they're just running them once. If they check off as positive, then that is a confirmed case and they put that into the books. Right now, with that new formula, we have 75 cases here in Ottawa. 7 of those people are in intensive care. And officials keep warning us, that is really just a snapshot of the past. Because of the time it takes to get those test results back, that number really refers to what was happening here days ago. They say the real number is likely in the thousands, and there are probably people walking around with symptoms so mild that they're transmitting it without even knowing it. And you know, you mentioned earlier in the show this idea of flattening the curve that's going around. You know, people are being asked to stay home, to self-isolate at home. Question is, if you don't have a home, where do you go to? We have here in Ottawa 7,000 or more people who are homeless. We just declared a homeless and housing emergency 2 months ago. And so the question really is for them, you know, where are the supports going? And what we're finding out is that the supports that are there usually to keep them healthy are no longer able to function in the same way that they used to. Staff at shelters like these have been asking their clients to leave for a good part of the day so that staff can disinfect the interior spaces. In late January, Ottawa became the first city in Canada to declare a housing and homelessness emergency.
So it really highlights the housing crisis actually in Ottawa, because if people had a home, they'd be able to self-isolate and practice all of those good things that we're being asked to do, that they're not able to.
In some cases, anywhere from 10 to 12 people may be sharing a room. And in the middle of a pandemic, the services that serve people who are marginalized have been dramatically reduced.
The people who are homeless have nowhere to go. And when there are services that are shutting down all over the city that they might have been able to utilize in the past, that's changed over the last 10 days.
Most of the supervised consumption sites have less hours. They often don't have as many booths that can be used because they're trying to distance between people who are users. Similarly, the food programs, you know, a lot of the places where people went for food or for support, those are often not operating.
That means more marginalized residents forced onto the streets and fewer options for help.
So there's just a huge pressure on all of the shelters for the basics, you know, food programs, emotional support.
That brings up another worry for frontline workers, the incredible pressure it puts on staff who are doing everything they can to stay in the game, despite a crucial shortage of personal protective equipment and sleep.
My real, true worry is for the staff, because if we have no staff, we have no system of care. And if we have no system of care, then there's nobody who's helping our clients.
And Ottawa's mayor says there are federal and provincial funds coming in and that they will be allotted directly to the shelter system, but there's no idea of if they'll reach them in time. There's no confirmed cases in the shelter system yet, but frontline workers say it's really not a question of if, but when. And a programming note, Dwight, for our Ottawa viewers, we should mention that we are tracking the latest developments here. On Monday, we will have a 30-minute local newscast coming from here from Ottawa, so we will continue to track all these developments and have our full news team back here to tell you those stories starting Monday at 6 o'clock. For now, it's back to you, Dwight.
Good news. Glad to hear it. Thank you, Omar. Construction continues despite the COVID-19 outbreak and the plea for physical distancing. That's caused some to question why the province has deemed the industry essential and others to walk off the job entirely.
There are many jobs where you're definitely in close quarters with each other. And the fact that we've been working like this for weeks with the threat of infection means you don't know who's infected. And when you have a culture where people come to work sick, people come to work coughing. I heard that a guy on my site that I already left was there with a fever, after I left, like working with a fever this Saturday. Everyone else is socially distancing. They're in their house. They're not leaving their house. They're afraid to go for a walk. And then you get up in the morning and put on your boots and go to work like it's normal and nothing's happening. But you try to buy a coffee and you can't. It's like you're living in a parallel universe.
Megan Kinch walked off her construction site last week in Toronto. She says conditions were filthy and there was little room for physical distancing. Kinch wasn't the only one feeling this way. Videos circulated online showing leaders telling their workers that if they don't feel comfortable, they can leave. Some sites have chosen to shut down, and the Ontario Construction Consortium is calling for a 2-week pause. The province is expected to release new guidelines for construction sites in the coming days. Now, we've been hearing it for the last few weeks. Don't panic buy. Don't hoard eggs or bread or toilet paper. The government says it is unnecessary since our supply chain is strong. So why are some shelves still bare? Now, Linanowski has been looking into that.
Grocery shopping essentially changed overnight. You have to line up outside, and once you're in, there's limits on what you can buy. So why are we seeing all these empty shelves? Experts say part of the problem We're all cooking more. And we're just not used to it.
I actually do believe that that a lot of consumers just didn't have a sense of what 2 weeks worth of food actually looks like. Food planning, we've been so spoiled by convenience that we kind of forgot.
Now we're forced to think about what we're making for breakfast, lunch, and dinner. That's because many of our go-tos are closed.
Pre-COVID, 37% of our budget went to food consumed at a restaurant. 37. That doesn't have a home anymore. So it went to grocery stores now. It's going to grocery stores now, violently.
It's been a problem for distribution centers, too.
Last week, we definitely had issues with getting product to the customer in the time. We're busy unloading trucks, and as soon as we were unloading, we were loading them up onto the customer's trucks. But generally, we've replenished ourselves this week, so we're in good supply.
So farmers are growing it, distribution centers have it, but there's another hitch. More people now prefer jumping online instead of gearing up to buy groceries.
9% of Canadians who've never bought food online before are buying food online. So they weren't ready for this. You have more personnel devoted to these orders online. So less people taking care of in-store merchandising.
So the system isn't staffed for the double whammy of online and in-store spikes. Plus, there's a production quota on certain items.
For eggs, it's the same thing. For chicken as well, poultry, we have quotas. And so chickens haven't stopped laying eggs. It's just a matter of getting those products to the market.
So what should we be doing to take the pressure off the system?
Tell Canadians don't panic. There's lots of fruit and vegetables currently in the system.
Grocers have learned or are learning that well, they need to discipline demand. So rationing is going to happen more often to make sure people are reasonable.
So be reasonable. Remember, the system was basically turned on its head overnight. And before you head out, plan ahead and only buy what you need. Natalie Nanowski, CBC News, Toronto.
I do take issue with an organization no longer caring about their safety and their well-being.
After the break, why an international student from Spain who is also a cancer survivor is in Windsor and not on a plane home like hundreds of other students. Stay with us, we'll be right back. 300 international students made their way back to Spain from Canada early this morning, but at least one student who was supposed to be on board didn't make the trip. CBC Windsor's Jacob Barker explains why.
I was in a state that I didn't know what was going to happen, but now I am 100% sure that I'm not leaving and that I'm safe here.
Uja Manzo is a 16-year-old scholarship student from Spain. Excited to be in Canada to learn, she's also a cancer survivor. Her host parent, Kimberly Wolf, understands what traveling could mean for Manzo. She is currently undergoing chemotherapy.
It absolutely has been a bonding situation, 100%.
Manso is here thanks to the Ortega Scholarship Foundation. However, due to fears over COVID-19, the foundation decided to pull 600 students out of Canada and the U.S. Initially, the foundation and Muskoka Language International, the placement agency in Canada, was asking that Manso be aboard the flight heading back.
I'm surprised because I thought they would take care of me and they would care of what would happen to me, but now they don't care about my safety and they are sending me home.
Manso was allowed to stay after Wolf contacted the placement agency, and her parents back in Spain contacted the foundation with concerns about her health.
I think I'm probably in the safest home I can be.
But Wolf, Manso's family, and others in Spain did not want to see any of the students returned. The virus is spreading rapidly there. Madrid, the destination for the flight, is being hit particularly hard. The number of dead in that country surpassed that of China's earlier this week.
I do take issue with an organization no longer caring about their safety and their well-being and having the control over them to send them home in a situation where their lives are put at stake.
Well, CBC did reach out to the Ortega Scholarship Foundation but did not hear back. However, in an email to parents and host parents, they did say that they would be traveling under conditions set by the Ministry of Health, that hand sanitizers and face masks would be provided, and that there is support staff and health professionals aboard the flight with the children as they head back to Madrid. Jacob Barker, CBC News, Windsor.
This is money right now. The machine is not stopping completely. We're just making it.
After the break, what it takes to make one of the hottest commodities during this outbreak: toilet paper. Amid the panic buying of this pandemic, one thing is flying off the shelves faster than others: toilet paper. Greg Ross took a tour of a warehouse that makes hundreds of rolls a day.
This is money right now.
If that's the case, then right now Barry Curry is in the money-making business.
We convert it, it goes back, and then the machine over there cuts it.
The machines and employees at his paper factory have been working around the clock to meet the demands for toilet paper.
Longer hours, the machines, the guys are not stopping. We're switching 24 hours. The machine is not stopping completely. We're just making it.
It all started a few weeks ago when toilet paper started flying off the shelves at stores everywhere, with people feeling the need to stock up out of fear of the spreading COVID-19 virus. Curry says it's gotten so bad, even he can't keep up with the demand.
What you see right here, by the end of the day, this is gone.
While he welcomes all of the extra business, he's still not completely sure why it's happening.
It took us by surprise. We still can't figure out why everybody ran after this. But whatever it is, they need it for.
Curry's company, Highland Trading, normally sells all of their product to wholesalers. But now many businesses and store owners are coming directly to him.
And actually, when I approached the owners, and I'm talking about big supermarkets, they actually want it. They actually want to buy it from me. They're like, if you have it, we're interested, we buy it. Money is not an object right now. Just bring it to us and we're going to buy it.
Curry says he hasn't raised his prices and has no plans to, even though he says his suppliers are jacking up costs.
They actually raised the price 22% per roll.
He definitely doesn't like it, but says he has to accept it because right now it's his best seller.
The second I make a call that I have these, the truck is going to be ready to pick it up.
Greg Ross, CBC News, Toronto.
That's it for us tonight. Thank you for joining us. We leave you with what is becoming a daily show of support for healthcare workers right across the country. Listen to that applause. Have a great weekend. Power and Politics is coming up next. Please stay safe, everybody.